Hello students, welcome to AriserTalent. As you know, we are studying chapter Why Do We Fall Ill. Now we are going to discuss important questions of NCERT. So here we go. Number one is, what is immunization? Immunization means to develop the immunity against the particular disease. So in this process, the person is given vaccine for the to reduce the disease or to develop the immunity temporary or permanently for a particular disease. Okay, so here we go with the immunization. Immunization is a technique to Immunization is a technique to develop temporary or particular resistance or immunity. Immunization is a technique to develop temporary or particular immunity. We can write immunity also against a particular disease. And it is generally done by vaccination. Immunization is a technique to develop temporary or particular immunity against a particular disease, and it is generally done by vaccination. It is generally done by vaccination. Okay. So what is immunization? Immunization is a technique to develop temporary or permanent resistance or immunity against a particular disease. It is generally done by vaccination. Clear? Next is, what precautions can you take in your school to reduce the incidence of infectious disease? So if we want to reduce the incidence of infectious disease, then what should we do? We should provide clean drinking water to students. Beside it, we should give vaccination to the students for the particular disease, or we should educate the students of the causes of diseases. If we will educate them, then definitely they will follow the precautions to avoid the disease. Beside it, do not allow the student in the school. Do not allow the infected student to the school for some time until he recovers. Clear? So here we go. To reduce the incidence of infection in school, we should, what should we do? We should provide clean drinking water educate students for cause of infectious diseases okay. Beside it, keep the surroundings clean. Okay, so we can say that we should keep the surroundings of school clean. Okay, even we must eradicate the vectors from the surroundings. Eradicate the vectors of diseases from surrounding proper sanitation of school, proper sanitation of school. Beside it, we should not allow the affected student to come to school until he recovers from the disease. We should not allow the affected students to attend the class. We should not allow the affected student to attend the class until they recover from the disease. Beside it, we should give vaccinations to students to develop immunity against the diseases. We should give vaccines to students to develop immunity or resistance power against infectious diseases. So how can we reduce the incidence? To reduce the incidence of infection in school, what should we do? We should, first of all, we should provide clean drinking water to the students, because as we all know that infected food means contaminated food and water are generally the cause of infectious diseases. So if we will provide them clean drinking water, so there thus we can reduce the incidence of infectious disease. We should educate students for cause of infectious diseases so that they can follow the precautions. Keep the surroundings of school clean, eradicate the vectors of diseases from the surroundings. Proper sanitation of school is must. And we should not allow the affected student to attend the class until they recover from the disease. Otherwise, if they will come to school, they will infect the other students also, they will spread the disease. So we should not allow the affected person or infected person in the school to reduce the infection. Then we should give vaccine to students to develop immunity or to develop resistance power against infectious diseases. So by following these steps, we can reduce the infection inside the school. Next is a doctor, nurse, health worker is exposed to more sick people than other in the community. Find out how she or he avoids getting sick herself or himself. Definitely, if someone is working with the patient or with the infected person, definitely he must follow some precautions so that he can keep himself safe. So here we go with the answer that to avoid getting sick, he or she should, what should he do? They should keep their surroundings clean, they should sterilize the surroundings and they should sterilize the equipments which they are using regularly. They should wash the hands after examining the patient and then they should wear the clean clothes. So by following these steps, they can keep themselves safe. So here we go with the answer. To avoid getting sick, he should sterilize the surroundings sterilized the equipments which are regular in use. He or she should wash hands thoroughly after examine the patient. Okay, he or she should wear clean clothes. Means proper sanitation of the surroundings and proper personal hygiene is mandatory to avoid getting sick. Clear? So how they can maintain proper sanitation and hygiene? They can maintain proper hygiene by washing hands again and again after examining the particular patient, and then they should wear clean clothes and they should keep the surroundings clean. They should use phenyl to keep the floors clean, to sterilize the surroundings, and then they should sterilize the equipments which they are using for the patient to treat the patient. Clear? So these are the points. By following these points, the doctor or the health worker can avoid himself from getting sick. Clear? Next is, a baby is not able to tell her or his caretaker that he or she is sick. What would help us to find out that the baby is sick and what is the sickness? If the baby is crying, we know that baby cannot speak, cannot tell his problem to caretaker. So what should he do? How you will identify, or how the caretaker will identify that the child is actually suffering from some disease? So if the child is crying continuously, if the child is feeling restlessness, okay, and if he is not taking the proper diet and the body temperature is high, then these are the symptoms by which a caretaker can identify that the child is sick. Now, what is the sickness? Sickness is diarrhea. Child is suffering from diarrhea because he is not taking the food properly and the body temperature is increasing. Okay. So, here we go with the answer. Part A. The baby is sick if the baby is crying continuously. If the baby is crying continuously and feeling restlessness, okay, improper diet or improper intake of food, improper intake of food and increased body temperature, or here we can mention improper body temperature. Okay, so these are the symptoms that we can find the baby is sick. Now, other thing is, what is the sickness? Part B, the baby is suffering from diarrhea. Okay, the baby is suffering from diarrhea. So these are the symptoms and this is the disease. Next is, under which of the following condition is a person most likely to fall sick? A is when she is recovering from malaria. if someone is recovering from malaria, so definitely the person is not likely to fall sick. Definitely he is recovering, means will feel better. Next is when she has recovered from malaria and is taking care of someone suffering from chickenpox. Here the condition is little bit matching with the given statement that the person is likely to fall sick. Why? Because someone is already suffering from malaria. Okay, now has suffered, has recovered. If someone has recovered, then now he or she is perfectly fine. Then if someone is suffering from chickenpox and he is taking care of it, him or her, then it's totally fine. Next is when she is on a 4-day fast after recovering from malaria and is taking care of someone suffering from chickenpox. Why? Now the condition C is more suitable to the given statement. Why? Because someone is already suffering from malaria. Okay, he or she is just a 4-day fast from malaria. So her body is not functioning properly. Her organ systems are not functioning properly, and she is feeling sick because she is not taking a proper diet. Okay, so loss of appetite is the reason that her body is weak enough. Now if she is taking care of someone who is suffering from chickenpox, then she is likely to be more prone, she is likely to be more chances, she has more chances to get infected with the suffering person if she is working or she is taking care of the person who is suffering from chickenpox. Clear? So here we go with the answer. Condition C is more likely to fall sick as person has the person has suffered from malaria. So her body's organ system are not functioning properly. She has lost her appetite. So her body is weak. If she takes care, she is, what the condition is? She is on a 4-day fast. She is on a 4-day fast condition. Fast after recovering. She is just a 4-day fast, and after recovering, she is taking care. She is on a 4-day fast after recovering. So she is more likely to be infected. So she is more likely. She is more likely to be infected or fall sick if she takes care of person who is suffering from dreadful disease like chicken pox, because her body is weak. Okay, and she does not have enough immunity to fight the disease like chicken pox. So she does not she does not have enough immunity to fight disease. That disease. Okay, so the condition C is more likely to fall sick as a person means she has suffered from malaria, so her body's organ system are not functioning properly. She has lost her appetite, so her body is weak. She is on a 4-day fast after recovering, so she is more likely to be infected or fall sick if she takes care of person who is suffering from dreadful disease like chicken pox, because her body is weak, so she does not have enough immunity to fight that disease. Clear? So this is the reason that she is more likely to fall sick. Next is, state any two conditions essential for good health. If we really want for a good health, so first of all we should maintain proper hygiene, and then we should take proper and adequate diet. Okay, so maintain a good health, what should we do? We should keep the surroundings clean, we should have the surroundings, proper sanitation in the surroundings, and we should follow the proper hygiene, personal hygiene, and then we should take a proper diet or adequate diet. Yes, here we go with the answer. Conditions essential for good health are what are the conditions? One should have adequate diet or balanced diet. One should have adequate diet or balanced diet, and maintain, he or she should maintain proper hygiene, sanitation of surrounding, clean drinking water. Even here only two conditions are asked, and I have taught you so many, so you can write any of them or you can learn any of them. So conditions essential for good health are: one should have an adequate diet or balanced diet, he or she should maintain proper hygiene, sanitation of surrounding is must, clean drinking water, he or she should take clean drinking water. Beside it, regular exercise is also mandatory for the good health. Okay, so these are the important points or conditions. By following them we can have a good health. Okay, next is, why is AIDS considered to be a syndrome and not a disease? As we all know that AIDS is caused by virus, HIV virus, and if and generally it is caused by the generally it is caused by the sexual contact or by the blood, infected blood transportation. Okay, so thus we can say that as AIDS is considered as a syndrome because once the HIV enters in the body, HIV enters, that is the virus which causes AIDS. It enters in the body, then what it does, it goes to the lymph nodes. Okay, then it reduces our immunity to fight the diseases. Like common cold, simple common cold can lead to pneumonia. Thus we can say that AIDS does not have its own symptoms. Okay, but once a person is infected with HIV virus, okay, then what happens, it many diseases can affect in that person, many diseases can affect that person. This is the reason that AIDS is known as a syndrome, not a disease. Clear? Okay, so here we go with the answer that AIDS causing HIV virus enters in the body through sexual organ or blood transfusion and goes to lymph nodes. Okay, as HIV virus which causing AIDS enters in the body through the sexual contact or through the sexual organ or blood transfusion and goes to lymph nodes. Then it damages the immune system. Then it damages the immune system of the person. Once it damages the immune system, that the person loses the ability to fight diseases and the person, thus the person loses the ability to fight diseases. For example, a simple disease like common cold can lead to pneumonia okay, and minor gut infection can lead to diarrhea with blood loss. Thus, the effects of minor disease turns to severe, become too severe, and they kill the patient. Okay, thus we can say that AIDS do not show any symptom, but thus we can say AIDS do not show do not show any symptom of disease, any symptom of disease. It does not show any symptom of disease, but it develops complex diseases, This is the reason AIDS is known as a syndrome. Here I am going to write, thus AIDS is known as syndrome, not a disease. Okay. Syndrome means a group of symptoms. Okay. So, AIDS generally do not show any particular symptom of a disease of AIDS, but it weakens the body by damages the immune system. Thus, the body is unable to fight the diseases, and then minor diseases can lead to severe diseases, and then this is the reason that person is likely to be killed, or these diseases can kill the patient. This is the reason thus AIDS is known as syndrome, not a disease. So, these were the important questions of NCERT. Hope you got it in a nice manner. Thank you.